So now I would like to call Dr. Surabhi Chavan, who is the host for second session. And session is a webinar on oral hygiene importance and their recent advances. Over to you, Surabhi. Thank
Thank you, Dr. Shital. As the host of the second session, I am Dr. Surabhi. Would like to introduce the second speaker of our webinar, our HOD ma'am. Dr. Monica Mahajani ma'am is leading the department since 2016. Ma'am has a numerous publications as a first author. She is a PG guide since 2016 and a PhD examiner as well. Ma'am is so joyful in the academics and imparting her knowledge and experiences with us. I invite ma'am to share the knowledge regarding advancement of the oral hygiene aids. Over to you, ma'am. Hello, ma'am. Hello.
Hello, Surabhi, am I
Yes,
audible?
ma'am. Yes,
Okay,
ma'am. Now you're audible.
okay. Thank you, Dr. Surabhi. Good morning, everybody. A very happy Oral Hygiene Day to all. A warm welcome to all the participants. Wishing you all a safe exit from these difficult times. With due respect and blessings from my parents, my teachers, and our beloved mentor, late Shri Khurana sir, I would like to start my session. This is a relatively
Ma'am,
light topic.
sorry to interrupt you, ma'am. Your PPT is not shared yet.
Yes, it's being shared.
Okay, ma'am.
So today's topic is oral hygiene, and today is our oral hygiene day. So what is oral hygiene exactly? Oral hygiene is an essential part of our everyday life. Good oral hygiene helps to prevent bad breath, tooth decay, and gum diseases.
Ma'am, sorry to interrupt you, but we can't see your screen.
1 minute, 1 minute. Sorry for the interruption. Please wait for a second.
Okay, ma'am. It's visible now, ma'am.
Okay. थोड़ा मोटा करा लगे मोटा कर दे हे मोटा कर नाही दिसत नाहीये Is it visible now?
Yes, ma'am. It's visible.
Hello, ma'am.
Ma'am, your PPT is visible now. Yes. Hello, ma'am. Any technical issues is there? Hello, ma'am.
Hello, am I audible now? Hello?
Yes, ma'am, you're audible now.
Okay, fine. So childhood is a mirror in which propensities of adulthood are reflected. Oral flora contains billions of microorganisms.
Ma'am,
Personal oral,
sorry to interrupt you, but your PPT screen is not properly visible. So if you don't mind, can I play?
no problem.
Just,
You can play.
just, sir, just stop your sharing.
Shital, it is
Okay, 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 ma'am.
नाही मग माझं शीतल
Yes, ma'am.
तू करू शकतो का हॅलो
Yes, ma'am.
have you started screen sharing?
Yes, ma'am.
Okay, fine.
Ready to go.
Next slide. Okay, so you can move to the next slide. Hello?
Yes, ma'am, it started. Yes, ma'am, it started.
Yes, next slide.
Ma'am, it's starting from introduction. So you can
Okay, fine. To introduce oral hygiene, oral health is an integral part of the overall health of a person, and the recent developments are therefore very heartening for those who are concerned about oral health. Childhood is the mirror in which propensities of adulthood are reflected. Oral flora contains billions of microorganisms. Personal oral hygiene is the maintenance of oral cleanliness for the preservation of oral health. Today, although toothbrushing is the most common method of mechanical plaque removal, we may still not be very good at it. And the reality is that only 60% of the total plaque is removed at each episode of cleaning. Next slide. The main aim of periodontal treatment is to achieve healthy status of the periodontium. Dental plaque and oral biofilms are the main causative factors for maximum periodontal diseases. Periodontal therapy helps to achieve reduction in pocket depths, bleeding on probing, helps in gain in clinical attachment level, prevents future attachment loss, and ensures long-term stability of the periodontal tissues. Along with the clinical improvements, there is also an ecological shift in the microbial composition from a microbial profile related to disease to that compatible with health. So now we go on to talk about the next slide. The most important manual plaque control aid which we have, and that is the toothbrush. Since the time of invention till the present day, toothbrushes are being continuously improved to promote healthier teeth. The manual toothbrush helped to clean teeth more effectively than the traditional which were used in the bygone days, such as the fingers, the sticks, and the twigs. Due to continuous research and development, more advanced toothbrushes such as the power toothbrush with rotation oscillation motion, sonic toothbrush, and solar toothbrushes were invented. These advanced toothbrushes promote better oral health with less efforts. Next slide, please. So the first is the power toothbrush. It is provided with a brush head which is capable of a variety of motions driven by a powered source which is present in the handle. It has side-to-side counter oscillation or rotation oscillation motion. The brush head is circular in shape. Less is required to brush than manual toothbrush. A brushing timer of 2 minutes is present. A sound is elicited after every 30 seconds to go on to the next quadrant. A pressure indicator is also present in many of the brushes. There are different types of powered brushes which are available. The first is, of course, the sonic toothbrush. It is available by the company Sonicare Philips. They are more popular and produce high frequency vibrations such as 1.6 million hertz. This leads to cavitation and stain removal. It also disrupts the bacterial cell wall, and it delivers 24,000 brush movements per minute. Then you have your ultrasonic powered toothbrush. It uses very high frequency waves to remove plaque and bacteria from the tooth surface. The brush emits a wave of 20,000 hertz. These waves break the bacterial chains. The brush, however, does not have any physical motion to clean the teeth. The entire cleaning is brought about by the ultrasonic waves. So these were the powered toothbrushes. These brushes can also provide a feedback to the patient regarding how the patient has brushed, the brushing time taken by the patient, the brushing mode used by the patient, whether it was for cleaning purpose, whether it was for polishing purpose, or whether it was used for sensitivity or for polishing. It also gives a record of battery charge status and brush head replacement required. Some brushes also have polishing cups for stain removal. A chip is also added to the handle to send information and view brushing feedback. Another technology in toothbrushes is your ionic toothbrushes. Next slide, you can go on to the next slide. There is the ionic toothbrush. It works on the principles of polarity. There is a bond between the pellicle and the bacteria. This brush reverses the polarity of the tooth surface from negative to positive, and hence the plaque bacteria get repelled from the tooth surface towards the toothbrush head, and in this way deplaquing can be done or plaque can be removed from the tooth surface. So this is the ionic toothbrush. Later you have the laser toothbrush. As you can see, it emits a red light. This is a modern toothbrush produced by a diode laser. It is present, the laser is present inside the toothbrush. This low-level laser therapy blocks the dentinal tubules, depolarize the pain fibers, block pain transmission, and reduce dentinal hypersensitivity. Apart from these newer toothbrushes, as you can see in the first picture, we have also a system for sterilizing the toothbrushes, and that is called as the UV sterilized toothbrush system. This system helps to sterilize the toothbrushes whenever they are placed in this system within 10 seconds. So our toothbrush, which is generally kept in the bathroom, harbors millions of bacteria. So to prevent bacterial contamination, these toothbrushes can be kept in this UV sterilized toothbrush system whenever not in use, and the brushes can be sterilized. This is especially indicated in medically compromised and immunocompromised patients. Another toothbrush which was invented lately was the solar toothbrush. Now, an innovation of a solar toothbrush is that it does not need a dentifrice. it is still in its innovative stage, experimental stage. And if it comes into the market, it will be really an innovation. Next slide, please. Now, some more toothbrushes which we have in the market. We have the foam toothbrushes. These are disposable, soft sponge soaked in chlorhexidine. These are specifically indicated for patients who are medically compromised and immunocompromised and do not need to reuse the toothbrush. It can be disposed of. So even hospitalized patients can use these brushes. Then you have the tooth towelettes. These are also called as the finger brushes or the eye brushes. The toothbrush is worn on the index finger and toothbrushing is carried out. These brushes are also disposable and they have to be thrown off. So they can again be used for medically compromised or hospitalized patients or even during your traveling times. A major disadvantage of towelettes is that interdental cleaning cannot be brought about with these tooth towelettes. Another toothbrush which is in the disposable form is called as the chewable toothbrush. It is a miniature plastic model toothbrush which can be used when no water is available. It is to be chewed and swallowed, and it is not recommended for children. So this toothbrush again can be recommended for people who are traveling or people who are hospitalized, which can use this toothbrush. There are few other inventions which have been there in the toothbrushes, and they are the C-Smart toothbrushes. This toothbrush tells its users whether caries is developing on its teeth. Laser technology is used. Reflected light is collected from caries and sent to the chip in the toothbrush. Other inventions in the toothbrushes are Oral-B Genius Sonicare and Diamond Clean Smart toothbrush, which can be connected to your Android phone and using Bluetooth, and it can show you how well you have brushed your teeth. So these are the various innovations. Then there is a Benjamin toothbrush which plays music while you are brushing the teeth. Then you have a super brush which has a triple-headed brush where all the three surfaces of the teeth are cleaned simultaneously, and hence it reduces the brushing time to just 30 seconds. Then you have the Colgate Plaqueless Pro toothbrush, which has optical sensors built in the toothbrush head to detect areas of teeth which are covered with plaque. A blue light is present, and the light on the handle changes from blue to white as the plaque is brushed off from your teeth. You have an Encompass toothbrush, which is a J-shaped toothbrush. This toothbrush provides optimum pressure to clean every corner of the oral cavity. And because of the shape of the toothbrush, it can clean half the side of the oral cavity in just 30 seconds. So it minimizes the time used for cleaning. So these were the various inventions which have been made in the toothbrush right from the manual toothbrush which we were using in the past. Now next slide, please. Next slide. Now we go on to the various mechanical plaque control measures which are used for interdental purposes. Now the most important mechanical interdental aid is your dental floss. Now dental floss can be used as an adjunct to toothbrushing. It reduces plaque and gingival inflammation and periodontal disease. However, the mechanism of using dental floss is very technique sensitive, and many patients find it very difficult to use a dental floss. So to avoid this manual dexterity, there was inventions in dental floss, and powered flossing was invented. Powered flossing devices are one of the recent advancements for mechanical plaque control. They consist of a nylon tip which slips easily between the teeth and is very gentle to the gums. They are effective in cases of patients especially wearing orthodontic appliances. Another advancement which has been made in dental floss is called as the water floss sonic toothbrush fusion. In this, you have the toothbrush along with the dental floss. So the dental floss carries out the interdental cleaning, whereas the toothbrush does the cleaning of the teeth. So there is both fusion of the two. Then again, you have your 2010 Sonicare Air Floss by the Philips company. This uses bursts of air and water to clean between your teeth. It is much easier to use than a string floss. Then you have a soft pick designed by the gum company. This introduces plastic floss with rubber bristles to massage the gums and dislodge the food particles present between the teeth. It works very well with patients with implants, crown and bridge, and orthodontic appliances. Next slide, please. Next slide. Another interdental aid which is commonly recommended for patients who have undergone surgery for periodontal disease, who have open spaces between the teeth, that is the interdental brushes. They are frequently recommended by dental professionals for patients with sufficient space between their teeth. While using, the brush is gently inserted between the teeth and should not be forced into the interdental space. The most common forms are the cylindrical or conical, tapered like a Christmas tree. The length of the bristles in cross section should be tailored to the interdental space which is available. Next slide, please. Now, the next important oral hygiene aid is your toothpaste. The health of the teeth and gums are maintained by cleaning the teeth regularly. Initially, toothpaste were made from ashes of ox hooves and burnt eggshells mixed with water. By 1900, toothpaste made from hydrogen peroxide and baking soda came into the markets to remove stains. In 1960, the first fluoridated toothpaste was marketed by Procter & Gamble. So, regarding the recent advances which we have in toothpaste are the herbal toothpaste. The herbal toothpaste were introduced to avoid the artificial ingredients who have a lot of side effects in our regular toothpaste. Most of the herbal toothpaste contain aloe vera, eucalyptus, tulsi, amla, clove oil, and mint. They are effective for reducing gingivitis and eliminating halitosis. These toothpastes also have many antibacterial properties. Then another recent advance in toothpaste was the nanotechnology dentifrice. Now this dentifrice in particular uses nanotechnology particles in their dentifrice. These particles are in the form of hydroxyapatite and titanium dioxide crystals. They coat the tooth surface and protect the teeth from decay. Hydroxyapatite provides a source of calcium and phosphate ions along with fluoride to remineralize the tooth surface. Silver nanoparticles are also incorporated in the toothpaste, which have antibacterial effects. Another new invention which was made in toothpastes was the regenerate toothpaste by the name Oral B Repair. It regenerates 82% of tooth enamel, which is the key ingredient. The key ingredients in these toothpastes are calcium silicate and sodium phosphate. It makes the teeth less sensitive and reverses the effects of early enamel erosion. Nowadays, toothpastes have also incorporated probiotics. Probiotics eliminate pathogenic bacteria from the oral cavity. An example is Revitin toothpaste, which is available in the market. Next slide, please. Next slide, please. Other toothpastes which have made newer inventions or popular are the whitening toothpaste. They used to contain hydrogen peroxide or carbamide peroxide as a bleaching agent to break the stains. Some toothpaste contain special silica abrasives to remove the stains. Bleaching agents bleach the chromogens present in the enamel and dentine, thereby whitening the teeth. Nowadays, toothpaste contain activated charcoal in a nanocrystalline form as a whitening agent in whitening toothpaste. Another toothpaste which was available, it was invented in the year 1987. And interesting about this toothpaste was that it was specifically invented by NASA for astronauts. And the innovation was that this toothpaste needn't have to be, it did not have to be spitted out. So that was a very interesting thing which this toothpaste had. And later on, again, because of this property, it was also used for patients confined to wheelchair or mentally handicapped patients or patients who do not have the facilities for expectoration. So this was the special toothpaste for astronauts. Then we had another invention in toothpaste. It was an award-winning toothpaste, which was Biomin C and Biomin F toothpaste. They contain fluoride as well as chloride ions. They relieve tooth sensitivity, tooth pain, reverse early decay, remineralize and repair enamel formation, neutralize acids, and also strengthen the teeth. These toothpastes contain bioactive glass materials which release calcium, phosphate, fluoride ions to form fluorapatite and fluorhydroxyapatite, thereby desensitizing the dentinal tubules as well as strengthening the tooth structure. Another toothpaste which was commonly used, which was invented, was specifically against dental caries, and this was a fluoridated toothpaste. It contains stannous fluoride. Example is the Oral-B Crest fluoridated toothpaste. It strengthens the tooth enamel. It has to be used only above 6 years. Fluoride is in the form of sodium fluoride or sodium monofluorophosphate, and it is especially indicated in orthodontic patients or patients with braces who have high caries index, or again patients who are prone to caries. So these are the fluoridated toothpaste. Then another invention we had in toothpaste was the desensitizing toothpaste using pro-arginine technology. It contains potassium nitrate and sodium fluoride. It decreases the dentinal fluid flow through the dentinal tubules and decreases the level of activity of the dentinal sensory nerves, thereby reducing hypersensitivity. A new technology containing 8% arginine and calcium carbonate, that is the pro-arginine technology, along with fluoride, relieves dentinal hypersensitivity faster. Example is your routinely used Colgate sensitive toothpaste. Then you have your Tata Control toothpaste containing pyrophosphate, which control calculus formation. Example is Crest Pro Health toothpaste containing stannous fluoride, antimicrobial agents, and sodium hexametaphosphate. There is another toothpaste by the name Pepsodent Gum Care, which contains zinc citrate and has antibacterial properties. So these were the various toothpastes which were invented over a period of years. So here I would like to just explain that all of you should not go by the name and the brand of the toothpaste. You should see what the ingredients are present in the toothpaste, what are the requirements the patient needs, and accordingly you can choose your toothpaste for your family. Next slide, please. Next slide. Hello? Okay. So now we have the other oral hygiene aids which are available. That is your water pick or your oral irrigation systems. Now these systems are especially indicated for patients during maintenance phase of periodontal therapy after the periodontal surgery. So wherever there are spaces between the teeth, a dental water jet or a water flosser or an oral irrigator, which is an electric device, can deliver a pulsating stream of fluid containing chlorhexidine, stannous fluoride, iodine solution through controlled pressure at the interdental areas for removing subgingival plaque biofilm present between the tooth surface, thereby reducing inflammation. Hence, it acts as an adjunct to toothbrushing. Next slide, please. Other interdental aids which are available to us are your end tufted brushes. It is a type of toothbrush used specifically for cleaning along the gum line adjacent to the teeth. The bristles are shaped in a pointed arrow-like manner and they adapt well to the gums. An end-tufted brush is ideal for cleaning specific difficult to reach areas such as between crowns, bridges, crowded teeth. End-tufted brushes are also used around fixed orthodontic appliances such as braces. Next slide, please. Now coming on to your chemical plaque control measures. The first thing you have are your mouthwashes. Mouthwashes can be used for various preventive and therapeutic purposes to treat oral infection, reduce inflammation, decrease halitosis, and deliver fluoride locally for preventing caries. Next slide, please. Various mouthwashes are available. The first one is the benzodiazepine hydrochloride, which is known as an analgesic, anesthetic, anti-inflammatory, and also known for its antimicrobial properties. And hence, it is recommended generally for recurrent oral aphthous ulcers, for stomatitis, for gingivitis patients. This is specifically indicated. The second one is, of course, which is very well known, which all of you are familiar with, is your chlorhexidine mouthwash, which is available in the form of Rexidine Plus. It increases the permeability of cell membrane, followed by coagulation of cellular macromolecules. It reduces the adherence of Porphyromona gingivalis to epithelial cells. The most important property of chlorhexidine is your substantivity. And because of substantivity, this chlorhexidine molecule can attach to the tooth surface and cause disruption of the bacterial cell membranes. Chlorhexidine can be used as 0.2% 10 volume rinse 30 seconds before going to bed, as well as at a 30-minute interval after toothbrushing. Mouthwashes based on essential oils such as thymol, eucalyptol, menthol in alcohol-based solutions are also present. They are mostly antibacterial and kill the microorganisms, and hence indicated for gingivitis and periodontitis patients. Then you have your cetylpyridinium chloride, which is generally used in halitosis patients. Next slide, please. Next. The other mouthwashes which are commonly available are your fluoride mouthwashes, which contain sodium fluoride and acidulated phosphate fluoride. Now, they cause remineralization of enamel by forming fluorapatite and fluorhydroxyapatite, making enamel more resistant to acid attack. And they can be used in patients with high risk of dental caries, patients having xerostomia, patients who have undergone radiation therapy, and for those who are undergoing orthodontic therapy. Then you have a molecule which is called as triclosan. It is a non-ionic antiseptic compound which is anti-inflammatory properties, used in many toothpaste and mouthwashes, and basically it is used in gingivitis and periodontitis patients. Next slide, please. Some more mouthwashes which are recent inventions are your pro-arginine technology. As you have a toothpaste, you have a mouthwash also containing 0.8% arginine, and it is also useful in hypersensitivity cases where it reduces the dentinal fluid flow and works well as a desensitizing agent. Another mouthwash which is recently used is called as mouthwash containing propolis. Propolis is a compound which is present in beehives and it is shown to be beneficial in the treatment of gingivitis, oral ulcers, gingivitis, as well as periodontitis. There are special mouthwashes for halitosis, particularly containing benzalkonium chloride, antibiotic agents, essential oils, as well as sodium perborate and zinc chloride. There is another mouthwash which was recently invented by the name Fresh Breath Oral Rinse for halitosis. This mouthwash contains green tea, aloe vera, and tea tree oil. Mouthwashes containing probiotics are also present. They prevent plaque buildup. 10 ml of probiotic mouthwash by the name Darolac is available in the market. Next slide, please. Clinical implications of mouthwashes. Mouthwashes are generally used as an adjunct to toothbrushing, especially after subgingival scaling or root planing for hypersensitivity, in patients having inadequate oral hygiene, post-scaling cervical hyposensitivity, or they can replace normal toothbrushing wherever it is not possible, like after periodontal surgical procedures, after intermaxillary fixation, or during acute oral gingival infections like acute necrotizing ulcerative gingivitis. Next slide, please. Now we come to the oral hygiene measures which are used in children. Very important. Newborn babies, their gum pads should be cleaned with a damp washcloth after all the feedings. Below 6 years, toothbrushing should be assisted by parents. You cannot recommend a fluoridated toothpaste for children below 6 years. A simple toothbrush, a small toothbrush with soft bristles, assisted by parents, can be done for children below 6 years. For children above 6 years who have developed manual dexterity, can brush their teeth well, can spit out, can swallow, for them, a fluoridated fruit flavored toothbrushes are available in the market. And you can recommend a power toothbrush for children because they are very interesting. Children can play music. They have cartoon characters on the toothbrush, which makes the brushing procedure very lovable, and children will enjoy the brushing technique. Then, of course, you have your oral hygiene regime for implant patients. Next slide, please. Next slide. Special care for implant patients. Whenever professional care is required, you cannot use your conventional scalers, metallic scalers, because it will abrade the implant surface. So you require plastic instruments which produce insignificant abrasion. And these plastic instruments can be reinforced with graphite or gold-plated curettes, which can be sharpened and can be used for implant patients. The prosthesis and abutments for implant patients can be polished with a rubber cup and non-abrasive polishing paste such as aluminum oxide, tin oxide, or acidylated phosphate fluoride free Profi pastes which have low abrasive contents and can be used as polishing paste. If peri-implantitis is there, you can always use a perio chip or a local drug delivery system, or some form of antibiotics can be delivered in cases of peri-implantitis. Next slide, please. Now, home care for implants is very, very important if implants are to be maintained in a healthy state. Oral hygiene instructions should be given. Smoking instructions, tobacco use should be told to the patients. Detailed verbal guidance and visual demonstration of the oral hygiene aids should be told to the patients. Oral hygiene techniques should be explained to the patients after patients have gone in for implant therapy. Next slide, please. Regarding home care for implants, we have to recommend the patients a soft manual toothbrush, or motorized toothbrush, or a power toothbrush can be recommended, but you need end-tufted bristles or soft bristles, especially for implant patients. Water floss can be recommended, or water picks can be recommended. Power tooth floss can be recommended for interdental regions to prevent plaque buildup. Polishing can be done even for implant patients. Next slide, please. So lastly, I would like to say that further developments are still going on day to day on chemical plaque control, and they will definitely be beneficial for special needy patients, old aged patients, for children who lack compliance and manual dexterity. And one thing which I would like to conclude is that oral hygiene is very important for everybody, because oral hygiene has a very close role with the systemic health of the patient, and it has been seen that the systemic health of the patient deteriorates if the patient has poor oral hygiene, as far as your diabetes mellitus is concerned or your cardiovascular diseases are concerned. And most important is your pregnant patients, where you have to stress the need of good oral hygiene, because it has been shown through several studies that pregnant ladies with poor oral hygiene land up with preterm low birth weight babies, or PLBW babies. So it is very necessary to maintain good oral hygiene right from childhood to old age. Each one of us should take efforts in maintaining good oral hygiene. Thank you. Thank you, everyone. I would like to thank everyone and thank you for participating, and a special a big thank you for my colleagues and my PG students who have taken a lot of efforts in making this session. Thank you, all of you.
Thank you, ma'am. Thank you so much. It was great to hear you. Thank you for putting up a light on advanced oral hygiene aids, ma'am. It will be really helpful to choose the right one.
Right. That is very important, actually.
Yes, ma'am. Now here, due to some time limit, we are taking questions and queries that will be directly shared to your mail ID, ma'am.
Okay, fine. I'll answer them immediately.
Okay, ma'am. The email ID will be shared in the WhatsApp group, or it is given in the PPT even.
Okay,
so
fine.
It will be shared soon in the chat box, ma'am.
Thank you, Surabhi. Thank you so much. Yes.
Thank you, ma'am. Now here we have an honor to hear words from our chairman, Dr. H.S.R.S.M, sir. He is always there to motivate us. He made some time available from his busy schedule for us. It will be grateful to hear you, sir. Over to you, our chairman, Dr. H.S.R.S.M, sir. Good morning, sir.
Good morning, sir.
I'm audible?
Yes, sir. Yes, clearly audible.
It is a good initiative by the Department of Periodontics, as we are going through tough time of COVID.